Greetings, everyone. Thank you for joining our webinar. We will officially begin in 1 minute at 12 o'clock sharp. And it's 12 o'clock sharp on the dot. My name is Tokara Nicole Thomas, and I am the Director of Land Use and Development here at Smart Growth America, where I lead the Center for Zoning Solutions. Thank you for joining us for our second webinar focusing on advancing health equity in partnership with community-based organizations. I am joined today with Samantha Carr, Sydney Amarin, John Robert Smith, and Joseph Mendaka. And today we're going to lead you through health equity, why it matters, and how you can tap into a brand new initiative that is being launched by the Center for Zoning Solutions to support community-based organizations in advancing zoning reform that is aligned with their missions. With that, we're going to go ahead and start and share our screen, and I'm going to walk us through a deck. Just some quick housekeeping. Next slide, please. Next slide, please. Today's agenda. Welcome. Go back to the agenda, please. Sorry. We're going to talk about the Center for Zoning Solutions. We're going to give a presentation on what is the Center for Zoning Solutions, what are our priorities, what is land use and health equity, and what is this new program, ZEST. Then we're going to hear from the Honorable John Robert Smith, and he's going to talk about how he put Meridian, Mississippi on a diet. Then we'll hear from Sydney Amarin of the Newport, Rhode Island Health Equity Zone, where she'll talk about her work as the Health Equity Zone at the Women's Resource Center and how she supported community-based organizations, as well as advanced health equity from her organization. Then we'll have a moderated panel discussion. Then we'll have an audience Q&A about the ZEST Technical Assistance Program. What is it? How can you sign up for it? What is our expected timelines, and so on. Then we'll wrap up and talk about next steps. Next slide, please. So before we get into the meat and potatoes of our presentation and conversation today, I want to tell you about Smart Growth America. Smart Growth America is a national nonprofit based in Washington, D.C., and our North Star is that we envision a country where no matter where you are, who you are, you can enjoy living in a place that's healthy, prosperous, and resilient. We achieve that through our impact model of thought leadership, advocacy, and technical assistance. Next slide, please. Our three biggest priorities are advancing racial equity, climate change and resiliency, and healthy communities. Next slide, please. Now we're going to talk about the Center for Zoning Solutions. I started the conversation saying that I'm the Director of Land Use and Development, where I lead the Center for Zoning Solutions. But what is it? The Center for Zoning Solutions is our national hub for all things zoning related. And our vision is that we envision a country where every community has implemented equitable land use policies that support people to live, work, and thrive, no matter where they call home. We really want to drill down on implementable zoning solutions and land use policies that are equitable. We want to focus on implementation because you can adopt a beautiful plan that has all of the equity frameworks and all of the equitable initiatives, but if that plan is not implemented and is simply adopted and lives on a shelf, it's not really helping. So we really want every community to be able to have those policies so that they can support their community members where they live, work, and play. Next slide, please. Our three biggest priorities for the Center for Zoning Solutions are codes for today's communities. We really want to help communities develop context-specific zoning and land use policies that replace the inefficient and exclusionary zoning regulations. By doing this, we believe that will help communities across the nation unlock economic, social, and health benefits in their communities. We want to advocate, and we do advocate for more housing in the right places. We believe that we can unlock housing supply across the country via zoning reform. And we'll do that by implementing effective policies that really focus on encouraging mixed use development as well as diverse housing types to create thriving, well-connected places. And then the third priority, we want to support a people-centered movement. We truly believe that people make the world go round, to quote the stylistics. And we think that we need people to help advance this zoning reform so that every community can have prosperity, economic diversification, and healthy. Next slide, please. What are these zoning solutions that I'm talking about? We kind of group them in four big buckets: comprehensive regulations, which advance smart growth. That looks like it can be as small as a by right text amendment that allows housing in every residential district in the community, all the way up to comprehensive countywide or statewide or citywide form-based codes for communities to focus on the form and use of buildings instead of just the use and segregation of uses. We also work on zoning and housing interventions that will allow a missing middle housing, such as duplexes, triplexes, mid-rise apartment buildings, infill development, and affordable housing typologies. We also prepare, review, and draft regulations, policies, programs, and strategies to facilitate mixed use and small scale commercial development. We truly believe in the power of small businesses to turbocharge local economies. And we feel that zoning has stood in the way of small businesses in Main Street America. And then finally, we also develop strategies to facilitate investment in civic and public benefits. We really want to see which ways that we can unlock these civic and public benefits for all via zoning reform. Next slide, please. How do we do this? Well, we follow the impact model of technical assistance, thought leadership, and advocacy. But what does that really mean? What does that look like? So we work with community-based organizations across the country. For example, we supported the West Side Legends in Pittsfield, Massachusetts. We supported the local advocacy group in Newport, Rhode Island, which you'll hear a little bit more about later in the discussion today. And we also support community-based organizations like you, which is why we're having this conversation today. We also provide TA for local and state governments, all under the auspices of how do we unlock the better quality of life for all residents via zoning solutions. We also do this through thought leadership. We recently published the HUD guidebook, Eliminating Zoning Barriers to Affordable Housing. This was a practical guidebook for practitioners, thought leaders, and advocates that provided regulatory solutions, programmatic solutions, proof of concept ideas, so how you can unlock housing supply via zoning reform. We also produced the Zoned in Economic Benefits and Shared Prosperity with Form-Based Codes. This was a document, a report that made the business case for form-based codes. We found in this report that communities with form-based codes and other smart growth regulatory approaches enjoyed much more economic prosperity than communities that did not. We also have events and educational programming like this. This CZRS webinar series is a part of our newly launched educational series. In the future, you'll see some programming from us, such as form-based code classes and zoning solutions for all series of classes. And then finally, advocacy. We collaborate and integrate with our family of coalitions at Smart Growth America, such as Locust, our coalition of triple bottom line developers, Transportation for America, and National Brownfields Coalition in developing and advancing their federal agendas. And we're also scoping what would it look like to develop and advocate for a national federal land use slash zoning strategy. Next slide, please. Why do you need the Center for Zoning Solutions? Well, number one, we're advocating for supply and well-connected high opportunity locations. We produced a report, we being Smart Growth America, that found out of the top 35 metros in the country, approximately 2% of those metros contribute 19% to the national GDP. So we want to look at ways to how do we continue bolstering those well-connected high opportunity locations by encouraging infill development and housing supply, so that we can continue strengthening our great country. But then we also want to think about, we don't want to oversubscribe those communities, right? They're already pretty well subscribed. People love them. You know them, the big metros. In addition to supporting those communities, we want to grow the number of well-connected locations across the country via our interdisciplinary approach with transportation. And then finally, we always use our impact model. It's our through line for everything we do with technical assistance, advocacy, and thought leadership. And it's a blend of those three things that are customized to the unique context of the community we're supporting. Next slide, please. But I want to take a moment and honor our history. We are building from many years of leadership that was established by the Foreign-Based Codes Institute. The Foreign-Based Codes Institute focused wholly on the adoption and spread and advocacy of foreign-based codes, which is a really amazing, comprehensive smart growth regulatory tool. And that steering committee has over 100 years of combined experience in developing the idea and concept of foreign-based codes, as well as serving as the standard bearers of foreign-based codes. So we are building upon that foundation when by keeping that foreign-based code steering committee as part of the CZS steering committee, where they advise us on next steps and how do we truly make sure that we're on the pulse of what's going on so that we can provide the relevant zoning solutions as needed. And foreign-based codes has a really rich history of producing reports such as Align for Affordability, Zoned In, which I mentioned earlier. And I mentioned also that we served as the standard bearers of foreign-based codes. We did that by producing the Foreign-Based Codes Award, which highlighted stellar exemplary forms of foreign-based codes that align with the standards of practice, which is something that we're going to continue integrating in the Center for Zoning Solutions program of work. Next slide, please. So we sunset the Foreign-Based Codes Institute and we stood up the Center for Zoning Solutions. So keeping that foundation and expanding upon it, what exactly are we going to do over the next several years? Well, in 2024, a little bit more history, we launched the Center for Zoning Solutions. It's Smart Growth America's newest program. We awarded the Foreign-Based Code Award to Kingston, New York, because their Foreign-Based Code featured equity as the cornerstone of the code. We partnered with the National Association of Counties to develop a technical assistance solution sprint for counties across the country, who want to develop affordable housing as an economic development driver. And then we published the Housing and Zoning Reform Guidebook that I mentioned earlier. In 2025, our program of work includes this CZS webinar series, the upcoming Smart Growth America Equity Summit. We will present several workshops and panels. And then we're going to stand up our third cohort of the Massachusetts Equitable Development Technical Assistance Program, which supports CBOs in Massachusetts in advancing affordable housing and zoning reform work that's aligned with their CBO nonprofits' missions. We also are going to launch the second cohort of the NACO Counties for Housing Solutions program. That's going to launch in April. And then we have the Zoning for Equitable Solutions and Thriving Communities Technical Assisting Program and related convening, which you all are a part of this launch today. Then we're going to launch the new Zoning for All classes later in 2025, along with presenting a form-based code class. 2026, we're going to continue these activities while also scoping that national federal land use strategy. We'll celebrate our 1-year anniversary with the Health Equity and Land Use Convening. So please mark your calendars for October 2026. And then we'll launch our people-oriented national land use strategy. Then beyond, we're going to continue advocating for that strategy, advancing our federal advocacy agenda, and advancing the CZS priorities. Next slide, please. So you've heard about Center for Zoning Solutions. You've heard about Smart Growth America. Now let's dig into health equity and land use. First, what is health equity? Health equity, excuse me for a second. Health equity, and I want to read the definition in full because it's very important. It's a fair and just opportunity for everyone to be as healthy as possible. This requires removing obstacles to health such as poverty, discrimination and their consequences, including powerlessness and lack of access to quality education and housing, safe environments, good jobs with fair pay, and health care. That's a direct quote from our report, SGA's report, Shared Spaces and Health Equity, Smart Growth America, and National Complete Streets Coalition, which was published in May 2022, and the full definition was just dropped in the chat. I wanted to go through that definition because that might be a question on our minds. Why are you here today? You're a CBO, you're planning health equity space. You might be fighting against childhood obesity which was caused because of zoning, which zoned out neighborhood grocery stores. You might be fighting for Black maternity health rates, which is a direct social determinant of health because of where and how we design our communities. You might be advocating for stronger educational offerings for K through 12 students. Again, that is a symptom of zoning in this country. All of these are examples of the social determinants of health, which are non-medical factors that impact people's health. All of that can be traced back to zoning. Zoning has designed our communities in ways that are designed for cars and not people. And as a result of that, we're seeing these impacts to our health via obesity, asthma, inequitable healthcare access, and so on and so forth. So today, we are here to offer the ZEST Technical Assistance Program to help reshape our neighborhoods in the built environment via zoning solutions, which will ultimately help you all in advancing your community-based organization's mission-driven work. Next slide, please. So now I'm going to turn it over to the Honorable John Robert Smith, and he's going to tell us how he saw an example of a health inequity that was affecting his entire city and what he did as the mayor to address that. Before I do that, I'm going to read John Roberts' biography, which is also going to be dropped in the chat for you if you want to review it later at your leisure. John Robert Smith is chair of Transportation for America and policy advisor for Smart Growth America. He served for 16 years as mayor of Meridian, Mississippi, whose Union Station, his signature project, is recognized as one of the best multimodal transportation centers in the country. Having served as a mayor of a city with a wealth of late 19th century buildings, he worked with developers to restore those buildings and is a strong advocate for historic preservation, believing that every community must respect its past and play to its strengths in order to develop and maintain a strong community identity. He helped define Meridian's role as a cultural center with the restoration of the Grand Opera House of Mississippi, the creation of the Riley Education and Performance Arts Center, and the selection of Meridian as the site for the Mississippi Arts and Entertainment Experience. Additionally, he secured $17 million in HUD Hope 6 funding to develop low and middle income housing. I want you all to help welcome John Robert Smith as he talks about his experience with Meridian, Mississippi. John Robert.
Takara, thank you for that kind introduction, and to all of you who joined the webinar today, it's certainly a pleasure to be with you. While I served 20 years in local government in Meridian, my college degrees are not in political science. They're in the healthcare fields. And I learned through my education that it was not whether I liked or disliked the healthcare data that I was presented. What I had to do was accept it as fact and then respond to it in the best way that I could. So why would we as local leaders and state leaders throughout the country care about something as personal as someone's health care and their health choices? Well, that's simply because our sedentary lifestyle and the foods that we eat are killing us as Americans. If you look at the obesity maps from CDC, you will see that they're almost identical to heart disease, diabetes, and the lack of physical activity that actually helps produce these disease states. Now, it's not just a matter of personal choice about one's health. Often it flows from the decisions we make in the built environment. And for so many decades in this country, we have focused on moving automobiles. This is what we've designed, chewing up large parts of our city centers with this infrastructure. But who are we actually designing for? Who is the end user? Is it just the individual in the car or the truck, or is it our senior population, which will be the largest senior population this country has ever known? Is it our children? They will be the largest junior population ever in the history of this country. And certainly there are our fellow citizens that have mobility challenges. Are we really factoring in what we provide for them? And those decisions are made at the local level. And when we decide to build only for automobiles, we have neighborhoods such as this. There are no sidewalks because no one who lives there ever imagines they will walk in that neighborhood. And it changes everything we do in our daily life, even something as simple as walking the dog. So you can see how the sedentary lifestyle based on lack of ability or infrastructure to walk and bike and row impacts our lives. So this is Meridian, Mississippi, on the border of Mississippi and Alabama, about 43,000 people when I was mayor. And, mayors run and say, we're going to improve the quality of life. And when I made that commitment as a healthcare professional, it also means I need to care about the length of that quality of life. And I realized that the United States has the highest obesity rates of any country in the world, and Mississippi and West Virginia, followed closely by Alabama, have the highest obesity rates of any state in the union. So if I care about my people's quality of life and their health, then what can I do as mayor to stimulate their use of the built environment? I can't force Meridianites to get out and exercise, but I can make it easier for them to do so. Notice the sidewalks in the downtown. With the Opera House and other investments, suddenly our people are in the downtown and we have wider sidewalks. We have safe crosswalks. Whether you're ambulatory or whether you're rolling, you can move all throughout the downtown and you'll see the plaques in the surface. They tell a story of the artists that come from Mississippi and from Meridian, and that story is told again in the built environment as you walk through the community. And when we built our Hope 6, we made the commitment to create the same infrastructure there for affordable housing and subsidized housing. Notice the wide sidewalks, the street lighting, the playgrounds, the senior citizen center, creating that moves people out and about the community. But it wasn't just in the downtown. We have the 15th largest urban forest in the country, about 10 miles from the mayor's office, 10 minutes from the mayor's office. And there we built biking paths, horseback trails, walking trails throughout. We connected our elementary schools with sidewalks so children can safely walk to school and to middle school. And then we built passive exercise equipment out along these paths. But if I'm really going to change, I've got to put Meridian on a diet. So I challenged the community to lose 10,000 pounds in 6 months. But again, you couldn't dictate that. I went to the hospitals and I asked them to open their gyms and exercise facilities to the public to use for free. I talked to a cardiologist and internist and said, you want your patients to lose weight? Meet them out at the Bonita Lakes Park, where the walking trails are. Meet them out there, walk with them, run with them. I went to the churches because in my part of the world, if you want to get to the largest number of people, you got to go to church. And I had been attending services throughout the community the whole time I was mayor. So I was accustomed there and they expected me to be there. But I remember one Sunday, Takara, I was telling a congregation about the foods that we eat that are so unhealthy in the South. And the minister said, now, Mayor, you gone to meddling. Said, if you remember when the Lord let down that sheet at St. Peter's house, he said you could eat everything on that sheet. Well, I was a Sunday school teacher for 23 years. And I said, yes, Reverend. He did say we could eat everything on that sheet, but Reverend, he didn't say you had to fry it all. So we change our diet habits and we change our exercise. Well, when we announced this program and we made it fun, the banks challenged one another because if you think of the most sedentary job, it's going to be a bank teller. The banks challenged each other. The biggest loser was First National Bank downtown, lost 500 pounds collectively. So we put them on this diet, and Oprah Winfrey heard about it. And we got a 4-day notice, and Oprah said, we're coming to Meridian to launch our national weight loss campaign. Now, Oprah doesn't go anywhere by herself. So there a full entourage came, and what you see are 5,000 people from Meridian and the surrounding area. The paper they're holding are pledges committing to lose their weight and to sustain that weight loss. And Takara, they lost over 9,000 pounds in 6 months. And I can tell you from going home, many of them have maintained that weight loss throughout. And what happens when you do that and you create a downtown that's walkable and bikeable, now you get the art galleries, you get the evening entertainment, you get the restaurants that pop up in the downtown. And it changes not only how you see yourself as a community, it changes how others see you. Takara, I can't tell you the number of times that those seeking to invest in the downtown have commented on its walkability. Obviously, the investment in the architecture there, but this is a national magazine that calls Meridian, Mississippi's unofficial cultural capital. That's mighty important in how it changes how you view yourself and others view you. Thank you. And there's a clip that Takara has made available of Oprah talking about coming to Meridian, and I want you to listen to it because Oprah doesn't sugarcoat it. Oprah was much more blunt in addressing those 5,000 people about what they needed to do for their future than I have been. It is well worth a listen. Thank you.
Thank you, John Robert. I also want to highlight before we turn it over to Sydney, the very inspirational story that you just outlined. And I want to come back to it during the panel discussion, but really want to highlight just now, you saw the vision, you saw an issue, and you made it happen. Later in the panel, I want us to kind of dig into what will you tell CBOs who have the ear of their community to tell their mayors or their leadership to get them to see the vision as well. Now I'm going to turn it over to Sydney Amron. Sydney is the Director of Prevention for the Women's Resource Center, where she has worked in different capacities within the department for the past 8 years. Sydney has a BS in Healthy Communities from Roger Williams University, a degree that combines both the education of public health and community development. Prior to taking the interim director position, Sydney spent much of her time supporting the community outreach efforts for the Newport Health Equity Zones strategies that are aimed to address the inequities that Newport residents face, supporting the decrease of the many forms of violence that exist. Experience working as both a community organizer and project manager has increased her skills to support the leadership development and convening between both community members and local partners, valuing resident voice, prioritizing conversations around racial equity, and intentionally supporting the shifting of current practices, policies, and structures that remain play a strong role within Sydney's core commitments. Thank you so much for joining us, Sydney, and the floor is yours.
Thank you, Takara. Oh my God, that's such like a hard act to follow. So I'm going to try my best to be as enthusiastic and fun. But thank you for having me. Yes, my name is Sydney Umrad. I use she, her pronouns. I'm from the Women's Resource Center. We are the backbone for the Newport Health Equity Zone. There we go. So the Newport Health Equity Zone, for anyone who is not familiar with that, the Rhode Island Health Equity Zone initiative was created back in 2015 by the Rhode Island Department of Health as an innovative approach to addressing health equity and investing directly in communities to create change. There are currently 14 health equity zones across the state, and we are seen right now as the first leaders in this model, but are having a lot of conversations nationally on how we can be supporting other states in implementing something like this. 3 things. So keys to understanding the Newport Health Equity Zone project specifically. So we are a place-based collective impact project. So our focus is geographic. We focus on the North End and Broadway neighborhoods of Newport. Our collaborative is made up of residents and organizations who work and live in the HES. And our goal is to improve health by changing the context and addressing socioeconomic factors in these neighborhoods. We are resident-centered, so residents are equal partners through every stage of the project. Our priorities and vision are determined by residents, and resident empowerment and capacity building is a fundamental component of the project. Decisions aren't made without residents at the table. We don't decide. Some of us are staff of HES, and we aren't allowed to just have a project and go ahead with it just because we think it would make the community better, right? So residents are kind of in that in every step with us. They have an idea, we're talking about it, we're getting them connected with other people. Then, if we're assessing a project, they're also assessing that project with us. Like, it is a side-by-side collaboration at all times. And our project is our process. So the focus of our work is not a final project ever, but we always use the methods and continuous improvement within our approach to get there. And that's kind of what we always say is, our project is never complete. Some things we put on the slide is we've been told that we are radically democratic. We have a culture of empowerment. We're action oriented. We use a holistic approach, and we really put our money where our mouth is. We're transparent and self-reflective. So those are some things that we love to just share and keep up when we're in our spaces and stuff that people has said about us. And we want to continue to make sure that we really, again, put our money where our mouth is and hold these principles up. Once we entered, so we have been in existence for 10 years. And once we entered our 5th year, we really started to reflect on our work up until that point and where we really seen our formal role as a collaborative. Our partners at this point had a strong understanding of the root causes, and root causes are not fixed, right, with a blanket of programs. So we really started to invest in where we see the gap, and that gap is where changing policies and systems through education and resident leadership. This image right here kind of shows our collective decision-making process that we developed to determine what areas of work we were going to commit to. So as a group, we decided to set guiding questions for any time we had a project brought to us that either a partner or typically not a resident. When a resident brings a project, we always uphold that because it's directly coming from a resident. But this is more reflective of any partner, decision maker, or anyone else that came to us. So we were asking, have residents asked for this? Are they involved in the planning and development? If that first question was no, then that was not a project we wanted to do. Do we need a program or strategy, or neither? We are big believers in things should not be duplicated, but instead use our resources to strengthen and work with our partners to make sure that what they're doing is equitable. Is someone else already doing it similar to that? If yes, can we work with them? Is there any evidence base? What does it say? What can we learn? And does this idea fit within our mission, vision, principles, and our current capacity? Our 4 key functions of the Newport Health Equity Zone is to convene. So we bring stakeholders together for resident-led community problem solving. We assess, so we keep a pulse on community needs and project effectiveness through innovative and ongoing evaluation. We build capacity, so we provide opportunities that increase resident and partner capacity to address health disparities in inclusive ways. And we advocate, so we advocate for policy and practices that will improve health equity in Newport, in the Newport HES neighborhoods. So while we were getting all restructured and figuring out, what is our new role after 5 years, COVID hit. And then a bunch of these gaps kind of started happening, right? And I'm sure the struggles of COVID is nothing new for any of you. But it's really impossible to not mention that time because it was such a significant time for us to be like, what do we need to be doing in this moment? And it shifted our work a lot. So just to set the stage a little bit, if you're not familiar with Newport, we are on an island. There's not a lot of land, and the land that exists is at high value. So at this time, a bunch of land was opening up. The bridge that led right into the city was being realigned. There was a large casino property that went up for sale, and it's smack down right in the middle of the affordable housing in Newport. And the residents were worried about gentrification. It was happening, right? Like residents were coming to us and they talk about all these things that they're hearing about and they're reading about, and all of a sudden it's like happening in our neighborhood. So one way residents wanted to combat that gentrification was through community benefit agreements. And the CBAs serve as a contract between a developer and the community per project to ensure that the community is benefiting from, in some way, from the developer that's coming in. Whether that be access to jobs, affordable housing, more open space, etc. We began supporting residents to advocate for CBAs, and the language did ultimately make it into the North End Urban Plan. But it just wasn't strong enough to be used over anything. So I think it's important to know going into this that we didn't know anything about CBAs. We didn't do this work. We needed help to learn about them and help to advocate for them. So this was a huge learning curve for us, right? Like we did domestic violence services. Then we got a health equity zone, and we're a backbone for our heads because we believe in, the root causes of violence. And all of a sudden now we're doing equitable development work, and it was not in our wheelhouse. It was something that we were like, we need to figure it out, but it's what residents need. So we then started supporting residents for even stronger language that really had some teeth in it. To really be able to show that this is what residents wanted. At first, a lot of this work didn't go through, to be fully transparent. And it isn't as cut and dry as I quickly explain this. As a backbone, we had to know when it was time for us to get legal help, and that no amount of advocacy was going to change what was happening at that point. So we had to hire an attorney that supported residents to ensure that, these new amendments went through, and it did. But we quickly learned to really accept that we don't know what we don't know, and we need to ask for that help. So flash forward kind of today, a lot of this groundwork really initiated the interest in residents developing this North End Equitable Development Strategy, which is, the cover is in the photo right there. And this was a strategy, we call it the needs. So if you hear me call it needs during the presentation, that residents worked on with support of Smart Growth America. So this needs lays out our priorities and really how to get to those goals that are being prioritized by residents, which include using strategies like community benefit agreements. So on this screen, these are the 6 community priorities that residents decided is what they wanted to focus on within this strategy. Community empowerment, housing affordability and mitigating displacement of existing residents, neighborhood development, including locally oriented retail and services, and cultural amenities, road safety and connectivity, workforce development and economic diversification, and public access to high quality, open, green, and civic spaces. So I wanted to put this up because this is in one of the pages that are, I know it's probably so small and hard to read, but it's one of those pages from the North End Equitable Development Strategy on high quality public or open space, green and civic spaces. And it outlines completely what success would look like if this is achieved, the current challenges that exist, partners, advocates, supporters that should be brought to the table, example tools such as zoning amendments, community benefit agreements, design interventions that could be supportive in how we reach our goal of what success looks like. We started listing out some short-term actions, so 1 to 3 years, and then some long-term actions, so 3 years and beyond, that the city can be doing to achieve equity within open spaces. And since then, we have had some major successes. So we have developed an active transportation advocacy plan. We've introduced resident developed green and complete streets ordinance. We've installed 40 signs as well as bike and walking trails in the neighborhood and successfully advocated for a bus to the beach because surprisingly enough, probably not surprisingly, as segregated as the health equity zone is, the Hez area in Newport, we are surrounded by water and many of our residents don't ever go to the beach because the ability to get there is nearly impossible. We've successfully advocated for affordable housing protections through an amendment to the North End Urban Plan, increase the visibility of equity as a citywide priority, most recently evidenced by zoning amendments proposed by North End residents. So we did get the passing of zoning amendments passed by the Newport City Council that added equitable development language on affordable housing, open space, and community benefit agreements in the new innovation district of the city. And we achieved long-term outcome of resident appointments to each of the following boards and commissions. So the Planning Commission, Newport Affirmative Action, the Bike and Pedestrian Advisory Commission, the Planning Board, and 2 Hez residents have been appointed to the City Council in the last 4 years, including most recently a member of the local advocacy group who created the North End Equitable Development Strategy. To us, relationship building is essential and trust is non-negotiable. So what I mean by that is it's important to develop these relationships with municipal leaders, of course, but it's even more important to us to develop trust with the community. Building those strong, meaningful relationships is crucial to doing this work. To be completely honest, because we are so connected in the community and we develop these relationships, and oftentimes it's things that the city doesn't want to deal with, we upset people, and we're okay with that. We are okay with, investing in what we believe and what residents believe the community needs, whether it upsets the city or not. So being okay with that, and, is something that we always like to talk about while we're having these conversations. And just some advice for CBOs, which is something Smart Growth and I talked about for people that wanted to do this work. So again, just to reiterate, you don't know what you don't know, seeking that support, right? So we had to go to Smart Growth America for support. They've done this, we haven't. We had to find legal support because they know the language and we don't. And that's okay. And then levels of momentum and engagement. And this is something I mentioned because we had to really accept it because we were upset about it at one point, but getting this North End Equitable Development Strategy out took a lot of work, a lot of time, and burnout is real. And I think acknowledging that and knowing that there will be times where you have tons of momentum during something, and then you have a little bit less, and then it goes up again, and then it comes back down, is okay. It doesn't mean that the work isn't important. It doesn't mean that people don't care about the work. It's that we are all human. We get exhausted. We put a lot of effort into many things. And being okay with that level of momentum going up and down is something that us as a community-based organization had to accept. And I think it's something that's really important for other organizations to be okay with. And that's it.
Thank you so much, Sydney. As we transition to our panel discussion, I do want to highlight something that you said, and I want to dig into. We are human. Audre Lorde has a beautiful quote that self-care is radical. And I want to highlight that as part of the burnout conversation. We have to take care of ourselves in doing this radical work. Now, with that, I'm going to channel my inner Oprah, and I'm going to interview you and John Robert Smith about health equity and CBOs. And let's dig a little bit deeper in how CBOs can advance land use reform to solve the root cause of the issue while they're working on the immediate issues. So with that, with my first question, I want to ask both of you, why should community-based organizations prioritize health equity and land use, especially when they're focused on addressing immediate crises, given that zoning reforms to improve health equity can take time?
I think it's clear when we look at the data and the maps we shared, our healthcare is a crisis. And to say, well, there's nothing we can do about that, that's between the patient and the doctor, well, that's just simply not so. There are things that city leaders, and you may have to create that city leader Don't sit back and wait for one to bubble up out of the surface. You may have to create that city leader by taking the issue to them and helping them understand, no, this is part of your responsibility. And you can make decisions that will improve access and the ability to have a better and a healthier life. And if they come back to you about, well, our codes don't allow that. Well, and I'd shared this with Takara before. I kept the Bible on my desk, and when a planning staffer would say, "Oh, well, Mayor, we got to have 2 parking spaces for every unit in the downtown. We can't do that." I'd just flip open to Exodus and I'd say, I don't see parking codes listed on those 10 things we can or cannot do. That means it's created by a human. That means we can change those. Draw up an ordinance that will change that. I'll get it passed by the city council. And so don't let ordinances stand in your way. They're not engraved on granite tablets.
Sydney, anything there you want to add from your experience working as at a health equity zone?
Sure. I just echo that. I think one thing we have really, things aren't always, they may seem like they're written in stone, but I think when there's enough momentum about something, and you build that momentum around that, a lot can be done. And I think power's in numbers a lot. And we seem to sometimes forget that, there's a lot more we can get done together than, by ourselves.
Thank you both. Sydney, I want to come back to you for a second. You talked about the process on the slide, the 5 steps of the process, and you talked about community a lot. Can you dig a little deeper in the actual mechanics of how you, as an organization working at a health equity zone, got the community members interested in this traditionally dry, wonky topic and maintain that momentum? And you talked about burnout, right? So maybe if you can just kind of give us some more concrete, tangible steps, or maybe some antidotes, something to add a little extra color to that, please.
Yeah, absolutely. I think for us, it's always finding something that's tied back to the work, that's something of interest that we have heard from residents before. We know right now that housing is nearly impossible to find. That is one of the major concerns. And transportation issues and things like that. So because we know that, access to go to a grocery store and whether you can get an apartment or not, are big concerns, we kind of tied that back into the development that was happening in the neighborhood. So this one thing being built is going to build housing that is not affordable to the people that live here. And that kind of created a little bit of fire in people that I'm not being able to live where I grew up or where my children go to school or where my family is because of the things that are happening. So I think we started a little bit, it's always funny. We always have a lot of groups that people come together and they want to talk about all of the issues, which I always think is a key piece. People need to be able to feel comfortable, talk about the things that are happening in their community, what they're kind of angry about, but then also it is our job on the flip side to then say, let's turn this anger into action. So I think being able to hold those spaces, those safe spaces where people feel comfortable coming in and saying I'm upset about this. And then again, it was our job to, be this is happening. It is going to affect directly something that you are passionate about, making that connection and then saying how can we move forward with this?
I like that. But also pin to that something you said earlier in your presentation, trust is non-negotiable. This process helps build and maintain that trust because it's so transparent. Now I have a question for both of you all. Coming back to planning and talking about people, the traditional community engagement process aligned with zoning reform and planning writ large is kind of anti-people. You both have created big initiatives that started at the ground with the people. What would you say was the secret sauce for turning that around in the minds of the practitioners, in the minds of the people who were directly affected and directly advanced these zoning and these big initiatives?
So you have to meet your public where you find them. So I mentioned going to churches where you can meet a significant number of the public places where I come from, but also in their neighborhoods. I was out walking the streets. I was going door to door. I was visiting those neighbors. I first listened to what barriers there were for them in getting to work, in getting to education, in simply getting to a grocery store to buy healthy foods. Listening to those things first, and then we took the 7 departments of the city and focused on a single neighborhood to address the issues they were facing. Police, fire, public works, community development, every single department looked at what they could do. So with the fire department, it was providing smoke alarms in the very older homes within the neighborhood. Any little thing that, again, talking about providing safety of life and creating opportunity of movement throughout the community.
Sydney?
Yeah, yeah. No, again, I echo about, meeting residents where they're at and where you find them is so important. When we started the Health Equity Zone 10 years ago, we had to do an initial needs assessment. When we took Department of Health funding, we knew that that was like the first step. They wanted a needs assessment. This is how we were going to figure out the areas of work that the community wanted to address. Now, we could have done the traditional route of just sending out a survey, right, and hoping that they fill it out, but we didn't. We hit the streets as well, right? We were at any local store and corner store that residents were at. We were at community centers, local food pantries, the senior centers. We were at barbershops, nail salons, bus stops, like anywhere that we knew that people were talking about the issues in their community, any places where they felt safe talking. And then we also, we trained local barbers, local hairstylists, local nail salons on how to have conversations with their clients that was even more outside of what they usually talk about. So let's start talking about what's wrong with your neighborhood. Let's start talking about like why the school system's so messed up. Let's start talking about why you can't cross a street and be able to get your groceries because there's like a semi-highway right there and cars decide to go 70 miles in a neighborhood. So let's talk about those things. And they were doing some of that with us. And they, residents felt so comfortable just like talking about those things because it was safe spaces. And then we slowly integrated ourselves. And that's how we really started creating that first level of trust with the community and being seen that, we are community first and everything else second.
Love that. Also love how you both represent different ends of the spectrum of the planning processes and getting people into the process, which is their democratic right? But now I want to kind of distill it a little further. How do you translate the jargon for lay people? And then a follow-up question, what would you directly tell a CBO who isn't necessarily in the zoning reform work, but they're addressing the issue and they want to become more versed in zoning reform? How is aligned with their mission? And then how do they convey that to their constituency? John Robert, start with you first.
Well, I was going to say, Sydney, you take this one first.
Okay. Sure. I mean, my first answer is like, fine, Takara and Smart Growth America. That's because we didn't know anything. I mean, we knew that development was happening. We knew issues were happening. We knew zoning reform was important to where we were after we started like reading through what currently existed in Newport, but we didn't know any of the jargon, right? Like what we knew is that we needed to educate ourselves first before we could be any help to the community. So we spent a long time, talking with our planning friends and our people that would break it down with us. This is what this means. This is what this means. And like really just being able to like understand it even just a little bit because we are no pros at this. And then we were able to hold meetings. What we actually used to do is when the city would decide to come and have a meeting, kind of like their checkbox meeting that they came and told the community about what was happening, we would have after meetings. And we would break down everything that was just talked about in that meeting. We would be there obviously to ask questions, to kind of be like, but there's still that sense of like, they're not breaking it down enough. So we would have meetings after those meetings where we would just like hang out in our space and have dinner and be like, what didn't we understand in this meeting? Let's break it down. And we'd have somebody, we were lucky at that time that somebody on staff actually had a background in planning. So she understood a little bit more of things and was able to break some of it down and help us and residents start thinking through it. But yeah, I mean, it's one of those things that's really, it's hard once you get your feet wet in it and then you kind of get stuck in it. But then you also are like, oh, I don't remember, I don't know all of this. Like, let me try to figure out. It's a lot of pulling your resources, a lot of talking with other people that you know to be able to come and like help us break this down.
Thank you, Sydney. John Robert, before you
So
end,
I would just add that the first thing you do is you don't speak in jargon. And Takara knows I talk about this with staff here. If you're addressing a group and they don't understand you because of your terminology, it's not their fault, it's your fault. So learn to speak in the terms that are real to people, not acronyms that you're comfortable with through your professional training. And it's important, and I'm sure Sydney would agree, when we work with communities, we don't come in and tell you what to do or provide the vision. You'll know your community better than we will ever know it. We want to hopefully broaden your horizons of what is possible and broaden ways that you can make the changes that you yourself know you need to make because you're in such close contact with your community. And we would have community meetings, and again, would take someone from every one of those 7 departments so that when we heard complaints or needs, there was someone there that could immediately address it, not take a list to go back to City Hall, but address it there within the meeting. And the public wants to see a quick response. They're accustomed to, well, let me get back to you, and then they never hear from the city again. So.
I think that's very right. A quick response. Low hanging fruit is very impactful though, because it can show that momentum and give you a guidepost along this long road that we have to travel. So we're coming up towards the end of our moderated panel discussion. I want to give you two one last rapid fire chance. What's the one thing if the attendees of these webinar walk away from this conversation? What would you want them to remember? That one thing.
You can make the difference. You can make the difference, and not to grow weary of work well worth doing.
Sydney?
Yeah, I would just say your communities deserve this. I mean, it is something that is scary to get into, but somebody's got to make that first leap. We happen to be those people that were like, you know what, we're going to start figuring out system change at a higher rate, at a higher level. Like, let's start digging through this. And we did it. And I know it was scary, and it was scary for the residents a part of it because it was something new you're learning. But yeah, I mean, your community, every community deserves equitable development. So.
Wow. Thank you all both for such powerful words. I will ask you all, I would like to invite you all to stay during the audience Q&A portion. So I'm going to open up the Q&A chat box. Also, thank you both for indulging me and letting me play Oprah today. The first question I want to highlight is, how do we get our municipal leaders to prioritize the needs of all community members when they only care about the needs of a few? Ultimately, what are the best practices for increasing civic engagement?
I can chime in.
You off mute. Let's start with you.
Yeah, I can chime in. My first thought is like, let me know when you get there because we still haven't. But I would say a few different things. So sometimes I say to people, you gotta play the game to change the game a lot of times. So while you're doing these big things and you're changing what this is in your community, sometimes you got to rub a couple egos, you got to rub a couple elbows with some decision makers, and they want to feel wanted and important. So we like to sometimes bring them in and have them, talk about like their goals for the future. But then there's space for residents to be like, this is what we want to see. We try to create that relationship, because sometimes there is a little bit of like, they want to feel like they're important as well, and not just like bombarded with everything that we want to change. So that's the first thing. The second thing is investing in resident leadership, because we have now had 2 city council members that have been a part of the HES, that have developed the North End Equitable Development Strategy, that has been a part of the local advocacy group. And those are your voices, and they're representing what you need and what you want in the community. So invest in that. And vote the people out that don't know, that don't believe in this work, because that is key.
I want to follow up on that really quickly, Sydney. Resources are scarce and resources are dwindling every day. You're at a nonprofit or community-based organization, and you might already be stretched in. Give me the 30-second pitch about why CBO should prioritize this type of work in the face of stretched in resources.
Yeah, so prioritizing this is because of sustainability, really, when you think about it. I think long-term sustainability comes from, being able to invest in this while we have the resources now. Resources are going away. Residents deserve to be so invested in that they can get up at a city council meeting and be heard without being asked, why are you here, but you don't show up for any other meeting, right? Like those are the things, or being asked, residents deserve to be a part of the conversation and brought to the table. And those are things that are not happening. So while we have funding, as it slowly goes away, investing in resident leadership entirely is like our number one, because at the end of the day, they are here when we are not.
And I would just follow Sydney's comment about electing people who already embrace these issues and will be your champions. Also, don't forget them when they're there.
Yeah.
When they do something that you approve of, let them hear from it, because I can tell you they will hear the negative voice. They need to feel your support, and when they're actually doing the things that you ask them to do, which can take a great deal of courage to do them and do them publicly and stake a re-election on these issues. So give them that kind of support, and backup is critically important.
Thank you both.
One thing I'll also,
go ahead,
I just wanted to add that one thing we've also noticed is that when we have had members of our collaborative end up on city council or planning boards or important boards and commissions, we have tried to form this connection that they come back after learning what they are learning in their spots. So a lot of times city council is super new, right? And you're learning all these things and the ins and outs and how to navigate a meeting and how to navigate just the conversations that they're having. And we've been able to kind of create a cycle that they come back and they're like teaching the rest of their constituents about, this is what to expect when you go to a city council meeting, or this is what to expect like when we're talking in chambers about things, or how to present something. Like they're able to use, when they went in, they didn't have tons of experience. Now they're using that to then teach what they are learning in those seats.
Before we go to the next,
it's important to show up at those meetings.
Mm-hmm.
There's one thing a councilman can do: they can count, and they
Mm-hmm.
have heads out in the audience. And if the room is full of the negative voice, that has an impact. Where if the room is there with those who are cheering on the results, that also has a very positive impact. So don't assume because they're supportive that they can now carry it with your absence. You've got to maintain yourself as a part of that support group.
I want to stick on this one for a little bit before we go to the next audience question. Sydney, you mentioned something. You mentioned having someone come back to the staff, excuse me, and share what you learned. Could you talk a little bit more about that? And then after you talk a little bit more about that, I'm thinking more from a community-based organization standpoint. Again, I'm resource stretched. I'm trying to figure out how do I justify this. Dig a little bit more into that. And then John Robert, I would like to hear a little more from you about putting back on your mayoral hat. What would make you pay attention to your residents to know that they are in it and they are serious?
Sure. So I also just want to mention, just a side note on the funding situation, to be fully transparent, we did not receive, we couldn't use any of our current funding on this, to be honest. It was a level of training residents to advocate. And although our department, our state funding, state/fund, comes through the state's actual federal funding, are supportive of all of it and love to share about it, the current funding that we had wasn't usable for this. So I will say we had to fundraise at a level that was definitely a stretch for us to find. It's expensive. I'm not like, I won't lie, I'll be transparent. It was expensive to put the North End Equitable Development Strategy together. But what's not expensive is investing in resident leadership. That can be done fairly cheap and fairly easy. You can create a lot of relationships with people that can share trainings and share skill sets and what they know, and really create that like asset mapping of resources that you have. So that doesn't cost a lot of money. And then your first question was bringing people back. Yeah, I think it's just important, again, similar to what John was saying, is that you don't want to forget about the people that you voted for either that are now in these seats. Bring them back, right? So use them. They are there. They serve you. Being able to use their knowledge that they're learning as they are on these new boards and commissions, and being able to connect with their constituents genuinely and consistently versus just at a city council meeting. Bringing them back. They want to be invited back. Most of our city councilors that especially have been kind of birthed through the HES, want to be back, want to be connected to their peers, want to be connected to community work still, because that's what got them there. So being able to remember to bring them back, use their resources, connect with them, and they're making connections now that they are like, higher up. They're making connections that we necessarily might not have had. So, and they'd be happy to share those with you.
And those stories that they tell and share, besides at the local level, they also change votes at the State House and in the U.S. Capitol. Legislatures and Congress are accustomed to hearing from those who have some financial investment in a policy. What they're not always accustomed to hearing are from those individuals that don't make anything out of the policy personally, but are impacted in their personal life. So those stories that your local leaders can then relate to the next levels of government are critically important. And you asked me, Takara, about a specific instance that I was familiar with. The disability support team in Meridian came to me and said they were, while we had begun making efforts on accessibility, they were still concerned. And there was a dear friend she was the drum major of our high school band, who was unfortunately stricken with Lou Gehrig's disease. So it was a real issue that was not going to get better for her. And so once every term, they would pick a day and I would spend that day in a wheelchair doing whatever I had to do as mayor. And it opened, I had to physically relate to the built environment, good or bad, and see that which was not working. But also the media follows you. So it opens the eyes of the public when the media reports on these kinds of things. And the public pushes for more and more and more address these issues that are depriving our fellow citizens from access to the things that we don't even think about needing access for. So it's when a group comes in and says, we think if you do this, it'll make a difference for a large portion of your community, that says a lot.
Wow. So I'm hearing illustrating the issue, bringing it to the elected officials and getting the media involved are some potential strategies. So thank you both for those answers. The next question from the audience. We've run into the issue of people accusing us of gentrification for advocating for healthy infrastructure such as bike lanes, wider sidewalks, quality parks, density, etc. How do we build a bigger tent so we don't constantly get accused of this?
It's tough. We just had this conversation not that long ago that the more you fight for equitable development, the more it leaves room for gentrification to happen. It's tough. It's a hard conversation that as you build more affordable housing and you have more walkable and bikeable neighborhoods and you have more art and open spaces and places to gather and things like that, that eventually it attracts people and they want to come and they want to live here. And I think it's one of those things that, we still we'll never fully figure it out, but it's one of those things that we continue to have conversations about. And right now, it's where we think a lot of those like community benefit agreements come into place a lot as well. It's like the first step to, if this is being built, then how are we making sure that, you could still afford to live here? And that you have a job that is in the city that you live, and then you can afford to live in the city that you live. So, because as of right now, in Newport specifically, it's a lot of people actually drive. It's tourism is really big here. So it's a lot of driving elsewhere because you can't afford to live. You can't afford to live here without a higher paying job. So you kind of can't work here. So that's been difficult, but I don't have a good answer, to be honest. It's definitely, again, it's one of those things that I feel like we go back and forth. Like as you make places better for people, people want to come and live here. And eventually, like will that kick people out? Maybe, but how do we create policies that help keep them here?
You have to get ahead of the gentrification issue before you actually begin. Because if you don't, it's too late. You can't, once it starts gentrifying, it's out of your control. All of a sudden, the community is overswept by that. So you're very conscious of that on the front end. And you make a commitment to those who live in that neighborhood. No, I'm doing this for you. This is for you. And your connectivity. So being able to have the job, but being able to get to the job. Or, we'll say, well, we need to get an education and get a job. Well, then I got to get to the community college to get the education, to get the job. We're doing that which you say you want us to do, providing those opportunities and those connections. But you really have to get ahead of it. When we developed where we could take a property that was owned by the state because taxpayers hadn't paid their taxes, usually airship properties in older neighborhoods. And we convinced the state to, because it was city taxes that weren't paid, to give those back to the city. And it's a little more complicated than that, but we worked it out. So we're into about $250 per parcel to get it back. Then we made those available to developers, but you had to build housing that reflected the neighborhood of a scale and a fabric, and it had to be affordable. And we defined what affordable was, because what's affordable in Meridian is not what's affordable in Newport. So you've got to define that locally, and then you've got to hold those requirements in place. And because you're in effect almost giving them an asset, you can afford to do that. And you'd be surprised what that does in individual lots or lots of 2 and 3 to change a community.
Wow, thank you both. I'll take facilitator's privilege here and also throw in my answer to the question. It's storytelling. And an old adage they told me in business school is build the well before you need it. So I took that as constantly building relationships and reaching across to people whom you might not necessarily think would be allies, but you all might share something in common. And so when you build in that relationship, you're building community, you're letting people know that you're there for them. That goes a long way alongside doing the actual work. Unfortunately, some people are just going to be naysayers, and you're not going to be able to get every single person on your side. But when you build enough of a critical mass, those positive voices will outweigh the negative. And the final point to just kind of wrap it up, Sydney mentioned it earlier about checkbox meetings, kind of questioning when you're pulled into meetings for community engagement. If you never had any type of engagement with another group and all of a sudden they're like, oh my gosh, Sydney, we need you in the Women's Resource Center to come to this meeting, that might be an opportunity of inquiry to say, is this a true, meaningful moment, or is this a check the box? So kind of doing all of the above, which I know can kind of be a little bit of a stretch with all the things we're doing all the time, but you're doing all those things, you're building those relationships, you're meeting the community where they're at, you're sharing the stories, you're honing the art of storytelling. That will help with that. Sydney?
Yeah, I just wanted to mention that one thing we notice is that a lot of people don't actually know that gentrification is actually happening, but they understand that they don't like the big box stores, right, coming. They don't like that, you know, Airbnbs are being like taken over by every apartment and you can't get an apartment because things are like astronomical for tourists and they're paying them. So we've started there a little bit too with understanding that there is an interest. We just didn't call it gentrification at first because that's scary. Gentrification sounds like something that's like kind of like, oh, what the heck is that? But there was interest in all the little pieces of what actually gentrification means. So we really started low in terms of that is gentrification, that is, and then eventually like people are talking about it and wanting to be a part of like these conversations that are happening.
And of course, the reverse is true. A neighborhood to say we don't want we don't want bike paths, we don't want wider sidewalks, we don't want safe crosswalks, we don't want those things because it may gentrify. Well, then you're saying we will continue to live in a place that is not accessible nor healthy. And that's not a choice they want to make either. It's not one or the other. You can actually, if your government and your business community will support it, you can actually have both. You can have that, the kind of neighborhood any one of us would want to live in. And we all like parks and we all like to be able to walk down. This isn't something that's relegated to an income. Too often it has been, but it should be open to any income. That's why when Takara opened with whomever you are, wherever you live, you should live in a place that's affordable and resilient and healthy. And we mean that.
We truly do. Thank you, John Robert, for wrapping that up. Um, I don't see any more questions in the Q&A chat. Excuse me. I'll pause here to see if anybody have any last minute questions they want to throw in the question and answer box. Let's see. And while that's going on, is there anything else coming up for either of you that you want to share, or something that we talked about earlier and maybe you want to take another bite at the apple and explain it one more time or add more thoughts?
I will just say that when we created the North End Equitable Development Strategy, and you have these 6 areas, and similar to the one that I showed on open space, there are 5 others for other topic areas. And what I will say is that we knew when we invested in developing this that this was not something that was going to be fully driven by us or even residents, that we needed you know, partner support, city support, because there's no way that we would be able to accomplish all of the short-term and long-term actions on every single one of those priority areas. So I will say, like, continue to build those relationships. There might be pieces that you never knew that somebody would be interested in wanting to tackle in their own organization. And also, I feel like we always receive these grants and stuff that says like, oh, you need to have resident engagement, but, and then certain, bunch of us are like, oh, let's like build our own little connect more, bring those residents together. We all have our own groups of residents that like gather a lot and feel safe in those spaces, and being able to connect them more is really the way to start building a larger following of people. And the one last thing I want to say is when I was doing some community organizing work, one of our community organizers who's been around forever was helping us also be okay with the fact that sometimes you're going to have a core group of people that show up for everything. Sometimes you're going to have a base of people that just show up because they're just going to come in numbers, but they're never going to show up for anything that involves them speaking or having to present on something. And then that's how you build. There are different levels of, again, like I mentioned before, like there are different levels of engagement. There's different levels for people to be involved, and it's not the same for every resident. And I think developing that as different places where people can opt themselves in and say, I have a lot of time to do this, but maybe I just want to be called upon as a number at a city council meeting because I want to be supportive. And then eventually there's a lot of like skill building and sharing of each other that eventually, those positions kind of swap and you find yourself being somebody that speaks at a city council meeting.
John Robert, any closing thoughts?
Yeah, well, as much as you can, vary the face that appears before your city council or your zoning board of appeals or whatever it is. So there's not a perception, oh yeah, it's the same three people back every time. It's important to know that no, it's shared by the larger community, and that I have stopped because your neighbors are busy.
Yeah.
They're preparing dinner at home for children, and if it's an evening meeting, if it's a daytime meeting, they're working. So it's important. It has to be important enough to stop what you're doing and remind the council and the mayor, that's what you're doing. I've stopped my day because this is important to me and my neighbors.
Thank you both. Such powerful words. And I'll throw in a closing thought as well. We are all residents of a community. We are all empowered to change the community to be reflective of all of us. And this process is how we can do it, whether we could do it formally via partnerships like the ZEST and support with SGA, or whether we do it as part of our daily duties as a resident of a community, or whether we do it as our day job as a practitioner. We all live somewhere. It's all our communities, and we're empowered to make those change. With that, I'm going to transition to the last part of our conversation where we're going to close out and wrap up. I want to talk through, first off, thanks so much to both of you, Sydney and John Robert. We'll share the deck afterwards via a wrap-up email with all attendees. We'll also share the recording of this webinar. We are officially kicking off the Zoning and Equitable Solutions for Thriving Communities Technical Assistance Engagement today once this webinar opens. We're going to share the application in the chat. And this was essentially our opening salvo in how do we help support you all in advancing mission-aligned zoning reform in your communities, right? That could look like us partnering to do a communications assessment. That could look like smart growth training for your advocates and your volunteers. That could look like us putting together technical memos to explain what the current comprehensive plan and zoning ordinances in your community look like and how they impact and or drive health equities, and giving recommendations for how you and your organization can advocate to eliminate those health inequities via zoning reform. It really runs the gamut. We talked through some of our examples of other technical assistance engagements to kind of give you all an idea, but it's really going to be a conversation between our staff and the applicants who are selected, about what is most impactful for them within that umbrella of advancing health equity in their communities via zoning reform. So I say that to say, put your thinking caps on, think about what are your needs, think about how we can potentially support them. We also will share like the actual type of technical assistance engagements We typically provide some stipends for the CBOs. We don't believe in asking people to do free work, right? So we want to try to provide that capacity via the education as well as a small financial stipend. We have some of the takeaways in the conversation in the chat. We'll share email addresses, and you all are more than welcome to reach out to us. I also strongly encourage you to complete the application. If you have any questions, reach out to us, and we're more than welcome to answer them to the best of our abilities. And if we don't know, we'll find a way to answer them. So again, thank you all for joining us for this webinar and this panel discussion. Thank you for the very insightful questions from the audience. And I hope that this has been helpful in some way for you all today. We are a little bit ahead of schedule, so I will gift you back 6 minutes of your time to go out and continue saving the world. Thank you all, and have a great day.